Hey y'all, my name is Joanne Montplaisir. I am the founder and owner of Luna Doula. I'm also a licensed clinical social worker. So in the modern definition of the word, because it does derive from a Greek word that means laborer, but in the modern definition, a doula is an educator, an advocate, a support person during the family planning journey. So, a doula provides advocacy in many different ways. And I'll just speak from the way that I practice, right? Because every doula practices differently. But my goal and role is to help the couple or the individual advocate for themselves. And so, what I'm doing is to help empower them to feel, the autonomy and ownership to advocate for themselves. And then there are times when I do have to step in. But for the most part, I want them to feel that empowerment in that space. And it's important for us to do that because, you think about how folks get really nervous and anxious in medical spaces. There's that power dynamic with the physicians and you being the patient. Physicians have, the expertise and the knowledge, but we also have expertise and knowledge in our bodies. And so I want to help reinforce that with the families and letting them know that they have that knowledge in themselves as well. Yes, I've been in situations where Black families, Black parents have not felt seen in the medical space. And I think that's because of the power dynamic. We're taught to completely trust our physicians, rely on them for all the information, not really get second opinions. It's like what they say goes. And I've seen times when physicians, when my clients bring concerns to their physicians and they're like, oh, well, no, that's normal, or that's fine, and not really follow up on that. High blood pressure, dizziness, lightheadedness, things like that are symptoms of preeclampsia, but they're not followed up on. Pain, right? And it's frustrating. And then when I am, adamant about them following up, they're timid. They don't want to ruffle feathers. They don't want to seem like the troublemakers. But, I'm right in there with them. So, there are times when I've had to step in, in terms of advocating for and with my clients. One example, recently, I actually just came from a birth yesterday, and my client wanted to use the restroom before she received her epidural. The anesthesiologist came in and we were saying, oh, my client needs to go use the bathroom. She was like, okay, but let me just ask you a few questions. And she's going through the consents and my client's standing there, bladder full, going through a contraction, and she's going through the consents like it's nothing. And I said, excuse me, she needs to go to the bathroom. Like, this can wait. And they're like, oh yeah, okay, sure. But you could tell that they were really annoyed with the fact that I stepped in. Another example with the same birth, she was on Pitocin, which is the induction method to get labor progressing. And they increased the Pitocin every so often, but they never informed her how often they would be increasing it, to what amount they would be increasing it. So they just come in the room and they're saying, oh, I'm just gonna increase your Pitocin. And I had to say, wait, excuse me, did you discuss this with her first? Well, no, the doctor ordered it. Well, my client didn't know this. And so then she had a chance to ask questions and then consent to saying, okay, you can increase my Pitocin. Things like that. There are times when I've noticed that my Black clients specifically feel timid during their appointments with their doctors. And so I think it's an issue of intimidation. They feel intimidated. There's that trope of being the angry Black person or the angry Black woman. So they're trying to, just not ruffle any feathers so they don't have any retaliation. There's a lot that's behind that timidness. And so I feel like I'm really there to really help ignite those fires and remind them that they do have power in this situation, that they're not the lesser in this power dynamic. So yeah. My journey to become, so I'm what you would call a full spectrum doula. My journey to become a full spectrum doula started way back when I was a teenager. So I'm always gonna rep that I'm Haitian. I'm always gonna rep that I'm from Brooklyn. And so back in the 80s and 90s, Haitians were listed as one of 3 groups that were at risk of spreading HIV. They were erroneously and, targeted for being one of the groups. And so I was an activist from a young age. My parents, would bring us on marches and things like that. And so learning about STIs and sexual behavior really young, and learning that there were groups that were stigmatized, obviously unnecessarily. As a teenager, I became a peer reproductive health educator. And so just wanting to empower people my age to take sexual activity into their own hands, right? Protection, learning about what access to resources they had. And then later as a young adult, I lived in Zambia and I helped with maternal health and safe motherhood, nutrition, and just seeing live births. I was like, wow, I really want to be a part of this, but I didn't want to go to medical school. And so when I got back to the States and found out what doulas do, I realized that I could blend my social work experience and my love for birth and, really help families, empower them to have beautiful births. The story that I heard about births were surrounded by pain and fear, right? Like, oh gosh, it's going to be painful, or, oh, I don't want to do this. And so I'm like, that shouldn't be all that there is when we talk about birth. We're creating new life, right? Why is it always surrounded by fear and pain? Why can't it be joy? Why can't it be empowerment? And so I really wanted to be a part of that movement and changing the narrative for future generations. As a full spectrum doula, I, provide support through the full spectrum of the family planning journey. And so that's birth and postpartum. That's what most doulas do. But there are also abortion doulas. I provide support during pregnancy termination, after providing that healing care, the surrogacy process, adoption process, and also pregnancy loss, providing that support during that unfortunate time. And so birth and postpartum are the main crux of what I do, but I want people to understand that there's so much more that doulas do. But during the postpartum journey, when I'm working with Black families, it's my favorite, my absolutely favorite time, because I usually say that parents are born when their babies are born, right? So babies are not the only ones that are being born during that time. And so being able to see them shift from not knowing, feeling like they don't know what they're doing, to like feeling fully confident, trusting their intuition, seeing partners. So when I'm working with a cis hetero couple, seeing the Black fathers take ownership over caring for their babies, right? A lot of times we hear the narrative that, Black fathers aren't present or Black fathers don't know what they're doing, but seeing them really like support their partners, support the mothers, bond with the babies. It's just like the most joyous thing that I can witness. And also seeing Black fathers support their partners through breastfeeding, the breastfeeding journey. Of course, we hear the narrative that breastfeeding is not a thing in the Black community, and like Black fathers don't support that, but just that's not true. Working with queer couples, in general, I really love empowering the partners or the non-gestational parent in during the birth and postpartum journey. So really working with them to kind of help build their confidence in supporting their partners, and seeing how they navigate stereotypes or expectations about gender norms, right? Labels, and also working with medical staff to really kind of break down some of their assumptions, right? The labels of mom, the labels of dad, the labels of pregnant person, woman, like all these like gendered labels are broken down in situations like that, trying to use gender neutral language so that my clients feel seen, so that their babies feel seen, I've worked with queer couples that choose to have non-gendered pronouns for their babies. And so that's also a way that, we kind of break down those gendered norms and, help to empower the parents to feel like they are seen in those spaces. As a doula, it really is important for us to create a safe space for Black family specifically. And what that looks like is, making sure that they have the knowledge before they enter into the birthing space. Part of the work that I do is providing childbirth education, the physiology of birth, the different symptoms, what to expect, what things to look out for, warning signs to look out for, questions to ask their OB when they go into their next appointment, helping them feel like they have an advocate in the room so that if they are asking for things and they're not being heard, that there's someone to follow up on that, right? They're so consumed in what's going on with their bodies in the moment that they're not really able to look at things from the outside. And so me being that extra person in there helps them feel like, okay, they've got someone who has their back. Also someone to recall the sequence of events that happens in that room, right? Because things kind of like, you forget things that happen. And so me bearing witness to birth is such an honor. And being able to recall that for families is another way that I create that space for my Black families. When I think about postpartum, creating that safe space is also that there's no judgment. There are mistakes that happen in parenting. There's no one way to parent. And so, if there's a mistake that happens, it's non-judgmental. How can we correct this? How can we work towards our goals and move forward? Without sounding hyperbolic and like an exaggeration, honestly, my Black clients' biggest fear is death during the birth process. Death and/or serious harm. That is the number one thing that I hear. Anytime I have a consultation, why is it that you're wanting a doula? Well, I hear about the Black maternal mortality rate, the Black infant mortality rate, and I just need an extra person in there. I just want to feel safe in the birthing room. And it breaks my heart. It breaks my heart because it's not, like I said, it's not hyperbolic. It's the actual reality of what we're living. And I will say that, yes, doulas are very effective. Doulas are necessary. But doulas cannot stop death. We can't. We can help mitigate harm. We can help maybe reduce the instances of trauma. But there's only so much that we can do in the room. And so it really is going to take a huge shift in policy, a huge shift in the medical industrial complex to create that real change to reduce the numbers of deaths for Black and brown women in the birthing room. It's tragic, it's heartbreaking, and I need to show up fully and be present fully in those moments. We feel these things too, and it's important that I take care of myself so that I can help take care of the families. And so what that looks like is, the birthing person is still postpartum even though they've experienced a loss. So they're still lactating, they're still bleeding on top of all the grief that's happening, right? Maybe they have other children in the home, so they're still having to be a parent in the midst of this immense loss and grief. And so just nurturing them, right? Drawing a bath. So, doing an herbal bath for them, giving them massage. I'm also a Reiki practitioner, so providing Reiki, making meals, cooking them meals, and also making sure that the other parent or the other partner or any of the other support people feel nurtured as well. Because when you nurture the community, you nurture that person, right? So you want to be able to make sure that they've built that community and they have that nest around them. So when I eventually leave, they have that safety net. Making sure that they have the community resources needed, again, for when it eventually is time for me to, step away, that they have that support. But mostly just love. There's a lot of love that goes into this work, and it's tangible. A lot of times, we say love and we think it's this ethereal thing, but love really is an action, and so we bring a lot of love into this work. So a large part of my doula role is to teach and provide guidance during the parenthood especially for my Black families, because they're dealing with a lot of other things in the society in addition to being parents, okay? So, one of my favorite things to impart on families from the prenatal side is that the moment that they find out that they're pregnant, that's when they become parents. So they've been making parenting decisions for a good 6, 7 months, even before the baby comes. And I feel that is a way to help them feel empowered in their parenting choices when the baby is actually here. You know, a lot of times you hear parents are like, well, I don't know, like the baby's still new, da da da. And I'm like, you've been making parenting decisions for months now. You've been a parent for a while. So you got this, like you know what you're doing, right? I really drive it home how important community is. That old adage, it takes a village, has been, reduced to one or two people, but we have to go back to that. We really have to go back to building our village, to building community. And so from the very beginning, I think it's really important during the prenatal period to think about postpartum planning. So, we do resource building. We look at what's around them. We look at what organizations are around them, what resources, what supports. And then we also look at who their village actually is. Are there grandparents? Are there aunts and uncles? Are there cousins? Are there chosen family, right? That can come in and help provide that in-person support, that can make meals, that can like take care of the baby for a little bit while parents are sleeping, that can take care of the other siblings while parents are sleeping and resting. What is the job looking like, right? What support are you getting from your employer? So basically building that support network, normalizing asking for help. That's another thing too. So you hear about, being a super mom and how that's a badge of honor, but really, baby, you need to ask for help, and it's okay to ask for help. And so normalizing when things are just too much, who do you reach out for help? Hiring a doula is not a luxury, it's a necessity. So normalizing that as well. Yeah, I think that's the biggest of it. There's a visceral reaction to thinking about the pain and the hurt and the confusion and the disappointment that happens around the birth and postpartum time. It's so visceral because it's still so present, and we don't have the space to express and move through that trauma, so we hold it. We transfer it, right? So I teach my Black families especially. We come into this parenthood experience with our own traumas. We come in with so much baggage, societal, personal, familial, all of that. So moving through that is not only helpful for us, but also helpful for the next generation, the future, the babies that we're taking care of. In my perfect world, the doula profession in 10 years will be a lot more respected than it is now. I would love for us to be seen as skilled, knowledgeable professionals who are an integral part of the birthing team. I would love to see OBs utilize us way before the actual birth, utilize our knowledge, you know, doulas have this ancestral knowledge as well that has been forgotten in the medicalization of birth. And so I would love to see that more respected and again, utilized way before being in the birthing room. I would love to see us making a livable wage. Making a livable wage so that we can actually do what we love and survive in this world. I would love to see more inclusive training of doulas. So doulas who work with obviously people of color, but non-traditional families, queer families. Yeah. The reason for everything that I do in this work, why I named my business Luna Doula, is because of my late sister Lunia. She died when I was 10. She was 18 years old. It was really sudden. But what I do remember about her is that she loved children and she wanted to be a pediatrician. And for whatever reason, circumstances, whatever the universe had in store for me, it led me to this path of working with children and working with families. And I always remember her. I always keep her at the forefront of my mind to bring dignity, respect to that family process, wanting to make sure that families feel supported, and at the risk of sounding corny, loved, right? Like that they feel held. Yeah, that is my why. So I do overnight postpartum work, and that is like my absolute favorite part of my postpartum work. There are some doulas that do daytime work, but I shine best overnight. It's just really me making sure baby is fed, changed, comforted. There's some babies that need to be held through the night. They are inconsolable unless they're held. You can imagine what toll that takes on the parents, right? So I'm there to really fill that space. I'm not only there to take care of the baby, I'm there to take care of the parents as well. And so making sure that the parents are fed, making sure that they have everything that they need for a good night, giving them report about how the baby did in the morning, and setting them up for the next day. So whether that's filling bottles for the next day, washing dishes, packing meals, cleaning the house, whatever it is that they need, and I customize it for whatever the family needs. If they have other children in the home, making sure that the children are bathed and doing well. If there are pets, making sure the pets are bonding well with the new infant and baby. So there are many different dynamics that I try to, pinpoint with my postpartum families. I learned of the Black Doula Project from my postpartum family. They were in need of my supportive services, and they didn't have the funds necessary to be able to pay for my fee. I do have a sliding scale fee, but even with that, they needed some assistance. And so they told me about the Black Doula Project. They reached out to you all reached out to me, and we made things happen. And I was like, how did I not know about this? How did I not know about this? And from then I started to share it with all of my Black families, whoever needed support. I feel like the Black Doula Project has changed the way that I engage with families, because now I know that if a family is in need of financial support, is, you know, is in need of doula support, that they can reach out to you all. Like I said, a lot of people think doulas are a luxury, not a necessity. And I feel like the Black Doula Project's grants are gonna be able to help families feel like doulas are actually accessible to them.